Hello A&P students, my name is Eric Barnes, and today I'm going to be taking you guys through a couple of examples having to do with your hamstrings and your quads. So in this first example, I'll read it real quick. So suppose you have a patient that comes into your clinic with pain in the anterior compartment of their thigh. So what muscles are a part of this compartment and what nerve is going to innervate all of the muscles in this compartment? And then also, what actions are these muscles going to perform? So to visualize this a little better, let's hop over to visible body. Alright, so now that we're in visible body, we can start going over the 5 muscles in the anterior compartment of your thigh. So if we start with the big one, that's going to be running all the way from the anterior superior iliac spine, and then all the way down to the medial surface of the proximal tibia. We can select this guy, called sartorius. And we can see, again, that it goes all the way from the ASIS to the medial surface of the tibia right there. So that's going to be the first muscle. So I'll hide it. And then now we have 4 more muscles that are all going to be a part of that quadriceps muscle group. So if we start with this guy right here, we can see that it's going to go from the anterior inferior iliac spine, and it will go all the way down and insert into this patella tendon. So this will be the most superficial of your quadricep muscles. So now if we hide that, we can see we have 3 more, and these will all start with vastus. So we're going to have vastus medialis, vastus intermedius, and vastus lateralis. And they're named from their orientation, so it's easy to remember them. So now if I highlight, we have vastus medialis, intermedius, and then lateralis. So now moving on to the nerve that innervates all 5 of these muscles. So if we select this nerve right here, we can see that it's the femoral nerve. And this femoral nerve is going to be innervating all 5 of those muscles. So that would be sartorius, biceps femoris, vastus medialis, vastus intermedius, and vastus lateralis. So now if we look at the right thigh, we can determine actions based on the line of pull of some of these muscles. So say we had some damage to the sartorius muscle here. So we can see from the line of pull that it will laterally rotate the thigh, and it will also flex the hip. So we can expect some weakness there if the sartorius muscle is hurt or damaged. So now if we hide that, we can look at our quad muscles, and all of the quad muscles together will insert onto this patellar tendon and will help in knee extension. So we can see from this line of pull, if they pull on this patella right here, it will extend the knee. So now let's go back to the presentation and start the next example. Alright, so now let's go over our second and final example. So say another patient comes into your clinic complaining of radiating pain down their posterior thigh. Now, what nerve could be contributing to this pain, and what muscles are innervated by this nerve? And also, what actions do these muscles perform? So again, let's hop over to the visible body and start going over this. So now that we're back in visible body, we can start going over what might be causing this radiating pain. So again, this was radiating pain in the posterior thigh. So there's actually a condition for this, and it's named after the nerve that might be affected by it. So I'll give you guys a couple seconds to try to guess exactly what this condition is called. Okay, so this condition is based off of the sciatic nerve. So the condition that this is sciatica. So if I select this nerve, we can see that this is the sciatic nerve. It's actually the biggest nerve in the body. So if this nerve is impinged or is damaged, we might have some pain in the posterior thigh. Now, all of the muscles that the sciatic nerve is going to be innervating is your hamstring muscle group. And that's made up of 3 different muscles. So you're going to have your biceps femoris, the short and the long head, and then you'll also have your semimembranosus and semitendinosus. So starting laterally, we have our biceps femoris right here. And that's the long head. You can remember that because the long head will be longer than the short, and then the short will lie immediately deep to that. So the sciatic nerve will innervate that long head, and then the common fibular branch of the sciatic nerve will innervate the short head right here. Then moving on, we have semimembranosus and semitendinosus. And the way I like to remember this is if you go towards where they insert, you can see that semitendinosus will lie superficial to semimembranosus. So the way I like to think of it is that semimembranosus is kind of a membrane that is wider and will not encircle, but kind of go around the semitendinosus here. And these will both be innervated by that sciatic nerve right here. So now we can start to go over some actions here. So if we remember the origin and insertion of all these hamstring muscles, we can see that they cross the hip joint at this level, and then they will also cross the knee joint at this level. So based on this line of pull, we can say that these hamstring muscles will extend the hip and flex the knee. So they will do opposite actions at those joints. So again, we have extension at the hip and flexion of the knee. So those are the actions that might be impaired as a result of damage to the sciatic nerve, or if these muscles are damaged directly. So that is all I wanted to talk to you guys about today. So thank you for your time and have a great week.